Hello everyone, I'm Angelina. On this opportunity, I will present a medical journal by title Biochemical Markers in Acute Ischemic Stroke. Table of Contents. First, Introduction. Explain the main problem. Second, Experiment. Expose the data and the procedures. Third, Hypothesis. And the last, Closure and conclusion. First, introduction. The diagnosis of ischemic stroke remains a clinical one with confirmatory evidence obtained through neuroimaging. Early ischemic change may be subtle or absent on CT scans. Analogous to the role of the creatine kinase or CK, MB fraction or troponin testing plays in the management of acute coronary syndromes, a biochemical test or panel of tests may be useful in the management of acute ischemic stroke. Second, experiment. We designed a preminary prospective cohort study to test a panel of biochemical markers in blood samples from patients with acute ischemic stroke. These markers were chosen because they cover important cellular components on the brain that might be damaged in acute stroke. Adult patients with a present neurological deficit due to ischemic stroke were eligible. 28 non-consecutive patients admitted at 2 hospitals with a diagnosis of acute ischemic stroke confirmed by CT scanning were evaluated. Their National Institutes of Health Stroke Scale, or NIHSS score on admission and their Modified Ranking Scale, or MRS score on discharge were recorded. All patients provide informed consent. Blood samples were drawn on days 1, 3, 5, and 7 at one hospital, and on days 1, 2, and 3 at the second hospital. Samples were immediately centrifuged and stored at -78 Celsius. The 4 biochemical markers were assayed using enzyme-linked immunosorbent assay. Normal values were obtained through analysis of blood samples from healthy blood donors. Thresholds for elevated levels were defined by the 98th percentile values for each marker. Analysis of the serum level from healthy subjects show no relation to age or sex. The mean age of 28 patients are 98 years, range 27 until 90. 18 were men. Stroke types were classified using the Oxford Community Stroke Project classification. First, partial anterior circulation stroke, or PACS in 10 patients. Lacunar stroke, or LACS in 8. Posterior circulation stroke, or POCS in 4, and total anterior circulation stroke, or TACS in 1. The type was unknown in 5. The time from stroke onset to initial phlebotomy was not controlled and varied from 3 to 24 hours. On admission, elevated levels of NSE were found in 89% of patients, TM in 43%, MBP in 39%, and S100 beta in 32%. At least one of the markers were evaluated on admission in 93% of the patients. By stroke type, 100% of the patients with LACS, 100% of those with POCS, and 1900% of those with PACS had elevated NSI level on admission. Conversely, none of the patients with LACS had an elevated S100 beta levels initially or subsequently. Peak level of NSE S100 beta and MBP, but not of TM, were significantly correlated with admission NIHSS. Similarly, peak level of NSI S100B and TM, but not of MBP, were significantly correlated with discharge MRS. 3. Hypothesis. This preliminary result confirms an important conclusion. Brain proteins are released into the blood after stroke. They can be easily measured and they correlate with outcome. Others have examined this question in a variety of markers. One advantage of using a panel of markers may be improved sensitivity. Time after stroke onset to initial phlebotomy was not controlled in this preliminary study. Given the recent use of thrombolytic therapy within 3 hours of acute stroke onset, biochemical markers will be of most use if they are elevated in the first hours after stroke. In addition, the specificity of the test was arbitrarily fixed by volumes from a group of healthy blood donors. Threshold for test interpretation may differ in population of patients with non-neurological acute illness. 4. Closure. Several new hypotheses deserve future testing. Use of the panel of markers may make it possible to identify stroke subtypes biochemically. Conclusion. Although we didn't show it in this small sample, a panel of biochemical markers may have greater diagnostic utility than any single marker alone. We are proceeding to address this question at defined times in the first hours after stroke onset. Finally, we reached the end of my presentation. I hope my presentation left a good impact in all my audience's heart. Thank you and have a nice day.